Oh my goodness. Hey everybody, Dr. Bueller here with Revive Upper Cervical and Pittsburgh Providers. And today, I just found out it's National Doctors Day.
Yes.
That's really cool. How appropriate. And today I'm with two of them, Dr. Emily Scott and Thomas Burnett of Regeneration Pittsburgh.
How's it going?
Yeah, so we met about a month ago, and that was after probably a year's worth of trying to get together. The two practices. You guys are here in Wexford, right across from the Pavilion. What is it called?
The Walnut Grill is kind of like everybody knows where that's at, and the Allegheny Health Network.
Yeah. And my practice is in the Roman Tower in Cranberry. But the purpose of the Pittsburgh provider interviews is just to introduce you to local providers. And so what we're going to do is we're just going to talk a little bit about your practice, your guys' background, the types of patients that you see, maybe some common Q&A stuff. And if you guys have questions, please be sure, if you're watching this live or you're watching the playback, please be sure to enter in your questions in the comment section, because I'm sure the doctors would love to answer it. Come back later, check in if you have any questions, and connect with you, because the whole purpose of this is to raise awareness in terms of what options patients have in Pittsburgh, when it relates to their healthcare. You know what I mean? Just good doctors, therapies, and services. So, Dr. Burnett, I know that you started this practice, when was it? 4 years ago?
4 years ago, almost to the date, yeah, four years ago.
That's exciting. Yeah. So
it's flown by.
I bet. What was it in the beginning? Why don't you give everyone kind of the elevator talk, if you had 30 seconds to explain what is Regeneration Pittsburgh, who do you help, what's it all about?
Yeah, so my background is physiatry, physical medicine, rehabilitation. So we do musculoskeletal medicine. So I started with the idea of doing all sports and musculoskeletal medicine. So your chronic low back pain, neck pain, but then I got into sports injuries, some more sports medicine, and then really got big into regenerative medicine. So we do a lot of stem cell therapies, PRPs, exosomes. And then that has even expanded into some of the anti-aging medicine. And then we brought in Emily, and then we further bulked up on our sports medicine, and then hormone optimization on top of the regenerative medicine. And then I guess everything was in mind of treating the mitochondria. So every way you can attack the mitochondria to improve that. That's through diet, exercise, sleep, and stress. So we do a lot of lifestyle medicine, lifestyle modifications. Again, talking about those 4 key pillars. And we do a lot of IV drips here. We do a lot of some of the aesthetics, a lot of the regenerative aesthetics. So everything's kind of supporting the mitochondria, the powerhouse of the cell.
Well, if we start, and it's funny that we finish there with the mitochondria, because that's really getting down to it. And I'm sure if you guys remember, somewhere in grade school, people probably learned about the powerhouse of the cell, So it's kind of funny how you distill it down. So why don't we start at that global and maybe the starting point with athletics, because I know most people have probably heard of pain management in terms of cortisone shots and things like that to kind of help with pain, but they may not have heard about some of the regenerative options, what is PRP or stem cells and all the rest. So can one of you guys kind of differentiate between the two, just because I would think that'd be a clean category of person, someone who has had an injury, whether it's athletic injury or an overuse injury. They probably have those options in terms of when is it appropriate just to manage pain versus when is it possible to actually regenerate an injury, and what's the difference between those two?
Right. Every injury is different. A sprained ankle is different than an arthritic hip, is different than an overuse injury in a throwing athlete. So we really take the time to get to know the athlete, look at their biomechanics of the surrounding structures, not just the isolated injury, and fine-tune what's going on. Sometimes that's through history, physical exam, advanced imaging, such as X-ray. Sometimes if we find an MRI to be appropriate, we can take a look at certain structures under ultrasound, and certain modalities like corticosteroid injections, like you mentioned. Those are used in more commonplace orthopedics, which there's a time and a place for those, absolutely. But some of these overuse injuries, like tendinopathies, muscle tears, labral tears, what have you, sometimes patients can be a good candidate for PRP or some other regenerative options like exosomes, stem cells. So I'll take PRP, and then you can explain some of the other options. PRP is platelet-rich plasma. So what we do is we take the patient's blood, we spin it down in the centrifuge, and we manually extract the platelets. Those platelets are chock full of growth factor, signaling factors to promote your own stem cells from your bone marrow to come to the area to heal it. It works really well to reduce inflammation and ultimately get you pain at least reduced, but hopefully pain-free, so you can function normally.
So if you were to, and I know you're being very kind, and I don't know if you caught this, she was being very politically astute, didn't want to downplay the corticosteroid use. I can totally respect that, but we're going to push a little bit, because I think people need to know that. Like, how would they know if what is appropriate for those corticosteroids versus if there's is it ever appropriate just to numb the pain? Like, is that does it depend on what your goals are?
Occasionally.
Yeah, I would say if it's more of an acute injury that would respond well to chiropractic care or physical therapy, then that's one time you just decrease the inflammation to allow the exercise, the rehab.
Yeah,
that's in my opinion. That's really the only time. I hate when people come back, and understand, and I do this, and sometimes this is the only option people have, is you're coming back every 4 to 6 months for repeats.
Yeah.
It's not healing anything. It just decreases things, and ultimately you're doing some more damage in the joint by doing that. But sometimes that's what keeps people moving, and that's going to offset some of this immobility.
I love that. So it's it depends on the goals, whether it's a short or long-term goal. Right. And as a chiropractor, it's funny because sometimes people will feel guilty. Oh, I had to take a Tylenol today, doc. And it's like, well, if you had to take that to get here so we could fix the cause of it, then that's okay. It's a give and a take. That's fine. And so then the PRP comes in, and I remember when I first learned about it, there was a guy who was explaining it where some of these ligaments and tendons, like a lot of people may be familiar with, like cartilage is white, right? I mean, it doesn't have a lot of vascularity to the tendon and whatnot. So correct me if I'm wrong, but these platelets are like your body's natural way of saying, hey, come on over here, blood, because we need help rebuilding this tissue. You know what I mean? So
it helps to upregulate what's called microvascularization, so the tiniest of blood vessels to help deliver blood and nutrients and oxygen to the area of injury.
Yeah.
So we have PRP, and then oftentimes we'll combine it with a substance called exosomes.
Yep.
Yes. What are those?
So it all falls into the regenerative medicine. There's different options. PRP or bone marrow aspirations, ones taken from you, considered autograft sources. We have fat as well, fat aspiration, and there's a ton of stem cells in there. But also donated sources like umbilical cord stem cells. Some question if there's true stem cells in there, but it's a ton of growth factors, and it really works. Either umbilical cord, allograft, or exosomes. You can think about exosomes they're in the placenta, they're in the umbilical cord. They are pockets of growth factors, and the common denominator in all of those regenerative procedures is growth factors. So the more growth factors, typically, the more potent in the regenerative capacity.
Got it. Are there certain types of injuries or age ranges of patients that do especially well with these two things? Like, if someone's over 60, is it like, I can't do PRP anymore, I just don't respond well because my ligaments are shot? Or is it still good for them just as it is for like a 12-year-old that's playing soccer or hockey, or you know what I mean? Like, what are the types of people that you see that benefit the most from these?
No one heals as well as an infant, right? None of us here aged as well when we were 10 years old. When something happens when we're 10 years old, we don't heal as well as we used to, and that's partly the blood supply is being pulled back. Partly because our stem cell quality has diminished a little bit. It's also being spread a little bit thin, or the quantity diminish. Platelets, you do replenish those. It's not like stem cells. Stem cells have been around as long as you have been. But platelets will replenish themselves. So you do maintain some of the potency from the platelets.
Got it.
But it's not going to be the same as a 20-year-old.
Sure.
It's coming for a labral tear. But PRP does not diminish as much as the stem cells. But when I'm getting over 40 years old, 50, definitely 60s and 70s, I'm almost always pushing towards an allograft source, a donated source from a live cesarean section, either the umbilical cord allograft or the exosomes taken from an allograft source, to augment either the amount of growth factors that can be released to set up that regenerative niche to help heal.
Yeah.
And she's right. As far as increasing the blood supply, that's absolutely crucial here. So we do things to improve the blood supply.
So making it super simple then, everyone can do it, depends on the sources. Who are like your top 5 that walk in the door that this stuff is like, oh man, I'm going to use it for them? Like, what's that profile look like of individual?
You mean most common
Yeah.
athletes?
Yeah, whomever. Within the general population,
I think
whether it's for providers to be able to refer to you or people that are watching saying, oh, yeah, that's definitely me. Like, what's the injury? What's the like, you know what I mean? I'm sure you see a little bit of everybody.
Oh, yeah.
We do, everything. But I think he and I can both agree that some of our most frequent flyers, for lack of a better term, are our CrossFit athletes. We treat a lot of CrossFit athletes. Not just, I don't think they're getting injured more per se, but maybe they are. But
also pretty passionate about their body and performance. So they're like, they want the best. They want to regenerate. They want to they don't want to.
But I love treating that crowd. It's a very receptive crowd.
Yeah.
I mean, a lot of times I'll throw out like 10 different recommendations and maybe 2 stick, right?
Yeah.
But I think that CrossFit crowd, just the younger, healthy crowd that really takes control of their own health.
Sure. Yeah.
There are people that are they're willing to spend and invest in their health, and that's a great population.
Yeah.
But you say that the perfect patient is somebody who's, I think, relatively healthy, doesn't have a lot of comorbidities.
Yeah.
I really like doing a soft tissue tendinitis, tendinopathies, plantar fasciitis, triceps, lateral condylitis, tennis elbows. Those in a person that can be receptive to the restrictions that we put in the diet and exercise and sleep and the stress that are really receptive. So I guess that kind of
I think it's great. Yeah, it's a little bit of a psychographic and a physical demographic kind of a thing. And it kind of opens the door. You said something there that we probably at some point would have to shift down to that mitochondria level and to stay on track and on time, because I know we can talk about these things so in depth. But you said something about the comorbidities. So obviously someone who's got a lot of different conditions, it's harder, right? I mean, it's harder for the body to regulate and heal, and they probably need a more holistic approach as opposed to this one injury and this one thing. They need like an entire reset from a functional standpoint. What were some of the things, because I know you mentioned a few, that kind of help facilitate more global change, whether it be some of the vitamin injection stuff that you provide, some of the hormone replacement stuff, like on the bigger scale, like the fibromyalgia patients of the world and the people with some of the autoimmune diseases. What are some of the things when they have those kind of like more global problems?
Yeah, we think about the body and its level of inflammation.
Yeah.
So you are much more prone to even musculoskeletal injury if you're full of inflammation, whether it's from poor diet, lack of sleep, excessive stress, environmental factors, smoking, too much alcohol, not enough exercise, or too much exercise with overtraining. So we look at the patient from the ground up. If you are not optimizing your 4 pillars, like Dr. Burnett mentioned, diet, sleep, exercise, and stress, we can do things to help you. Absolutely, we can do things to help, like our IV vitamin drips, our IV exosomes, dry needling to help with sore muscles, some other supplements like magnesium to help with muscle recovery and sleep. But we really need to build a good foundation.
Yeah,
So
absolutely.
we talk a lot about that.
I like in people fasting, some type of intermittent fasting mimicking to really sensitize the insulin, or sensitize your body to insulin again, to really decrease the inflammation. It's just so crucial. That alone can be life-changing for so many people. That was life-changing for me when I started doing this 10 years ago. Just intermittent fasting truly is one of the best things you can do to prevent cancer, prevent diabetes, prevent metabolic syndrome, really prevent Alzheimer's. It's just incorporate some type of fasting and improve deep sleep. And I can go on a diatribe on that too.
Yeah. Well, I know that we were introduced to fasting through the Isogenics, which is kind of like this done-for-you 30-day thing. And that was like the gateway drug, no pun intended, into the world of fasting. It was incredible. Yeah. And my wife used it because she had a prior disc injury. And we had gotten her stable, chiropractic and balance of the spine and all the rest, but she'd have a bad day, once in a while. And she didn't want to go to the gym to work out because she didn't want to re-injure or aggravate her disc, but she thought, I'll lose weight through this weight loss thing. Well, she lost weight and that was fine, but the surprising thing was just general anxiety, kind of the depressive fog that would come in the mornings, and the back pain. Like, all of that, gone. She actually noticed she wasn't biting her nails anymore either. Like, there was this, when you have just a little subconscious stress, you just kind of bite your nails, and she'd always been a nail biter. But at the end of this 30-day system, she was like, I have nails. Like what does fasting have to do with like my stress levels? Like people don't realize it's a huge
we see that a lot in concussion. So there's such an overlap between health and gut health, and concussion and brain health. And you know this, I mean, right?
Yeah.
The gut is tied to the cervicals or the spine and the brain, and it's so important to address gut health and everything. There's always that joke. There's always an asshole in charge, and it's so true here.
That's hilarious.
Regulates everything.
So, just as an example, because I want to kind of like hone in on some of the different things within these categories. So, like we were talking a little bit before you're finishing up, Doc, about the NAD plus benefits. So, just as an example, because people would say like, "Oh, I take multivitamins." So, what's the difference between? First of all, what's the difference between injecting versus supplementing or having a good diet? Yeah. And then, what are some of the specialized injections that you do beyond? The vitamin B and the D and magnesium and things. Some of these other ones like the NAD plus, and some of the other ones I think I saw in here. But there's some unique ones that I think
there's IV ozone. So NAD is kind of in a category of its own. IV ozone, super. I'm just in love with that. There's just so many different ways we can take that.
That's I'm guessing to reduce oxidative stress, or is that like for post-concussion stuff?
So you're inducing some oxidative stress actually.
Oh, really?
Yeah, right. But oxidative stress exists for a reason, just like every time we go out and exercise, there's some oxidative stress. You think about it as a blanket, stress is bad, but not necessarily when it's like a hormetic effect. So these little snippets of oxidative stresses, like you're getting with the ozone or like we're doing a good exercise, has this overlapping hormetic effect, this long-lasting changes. And it's all about, I guess, bringing the immune system back into some type of homeostasis.
So would you use that on someone whose immune system is kind of like lethargic?
Yeah.
Is that kind of so? What's
that, or it's in hyperdrive. Either way, it's a high or low. You're kind of bringing it back into homeostasis. So both to improve the immune system, to fight off, because ozone is natural antiviral, antibacterial, antifungal. That's why you see like you get like a used car that smells like it's like a metallic smell to it. Like it probably smelled terrible like 2 weeks ago, then they cleaned it with ozone.
Got it.
Or a hotel room, right? It kills all that stuff. So it's naturally, so it will ramp up the immune system and be a natural antibacterial and antiviral. But then it also decreases a hyperactive immune system like RA or thyroid issues, the Graves' disease, really brings things down to kind of homeostasis.
It's fascinating. Yeah. Love it. What about the NAD molecule? Because I know that's an important one.
And so NAD is at the heart of the mitochondria. It's a precursor to this electron transfer, smooth transfer from energy sources down into, food sources down to energy. Mm-hmm. And mitochondria is what we all learned in high school. It's the powerhouse of the cell. So there's the only way we're going to survive how big we are in our metabolism is because we can produce so much energy throughout the day, and that's for the mitochondria. In the way that as we age, our NAD levels decrease a little bit, so you get less than this efficient sometimes transfer of electrons down this electron transport chain. Mm-hmm. So doing something like NAD to really bulk up that transfer, smooth transfer of electrons, can also decrease this log jam or traffic jam of these electrons, and that prevents the free radical escapes.
Yeah.
But also just really improves the efficiency of the mitochondria. Mitochondria controls everything from the way the brain functions, the way the body functions, the way the muscle functions. The more active the muscle is, the more mitochondria you have. The brain, the heart, all the nerves, all the muscles.
Yeah.
Really, that's what white meat and dark meat is. That's why you have more mitochondria, dark meat. I don't know where I was going with that. But so NAD actually it helps the efficiency of the mitochondria. So everything that the mitochondria is good for: energy, sleep cycles, detoxifying, picking up on the subtle defects in the DNA. This is what the NAD can help the mitochondria to do.
Sure. And I think the patient profile there, you had mentioned a couple just then, but I was sharing with you earlier, we had a patient that a mentor of mine was recommending for this that was just completely lethargic, like anemic, wasn't eating well, wasn't responding well to traditional therapies, is just currently in a very bad place. And when the body is so incredibly depressed, it was like NAD was like, we got to make sure that those mitochondria on a cellular level are just doing what they need to do, because if they're shot, that's it. That's the energy production of the whole body, of each organ and tissue. If your mitochondria is not working right, there's some trouble there.
So I think this is exciting. So I think we currently have the technology. The technology exists for us to all live to 200, 300 years old. Right?
Yeah.
Truly,
that's a statement right there. I like that statement. It's a strong statement.
I don't know if it's going to be accessible to everybody.
Dr. Burnett's going to be the first.
I know. I won't even
200-year-old.
And it's not even me. The technology exists. There's a mouse apparently out there that's just living like 60 or 70 years old, and the mouse lived like 3 or 4 years. So whatever that time span, 20 times their normal lifespan. But and I think it's all going to come down to the mitochondria. If we can somehow retain that mitochondrial DNA, and there's mitochondrial stem cells as well, so if we can replicate those and transfer that genome shift, that's where truly I think is so exciting. There's so much research going into mitochondrial health, but everything we do is just the simple stuff that helps support the mitochondria, and it's unfortunately the simple things that people do not address on a day-to-day basis is diet and exercise, sleep, and avoidance of stress, or mitigating stress, I should say.
Sure. Yeah.
That's cool. We come back to all the time. So, but I think this is where, in my opinion, sorry, I didn't mean to interrupt.
No, go. Yeah, you're good.
This is where I think medicine does not do a good job of, or traditional medicine doesn't do a great job of really addressing those before you go on to pills that you would take, right? I think we need to spend so much more time in preventative care, and I know you guys talk a lot about that.
Yeah.
And so do we. Every visit should address those 4 key pillars, not just blood pressure. Every family you go to needs to address, and how those are going to affect those other pillars, right?
Yeah.
You mentioned briefly about genes, and this is something that we are really excited about. Everybody's genes are obviously different, right? What do your genes tell you? What is predisposed for you? But what genes can you turn on and off? And so we don't know until we look. So if you want to explain more about our epigenetics and the investigation into personalized medicine.
And you can test your DNA, and 23andMe or some different types of companies that can do that. So it'll tell you, and if you ever had 23andMe?
I know about it, but I haven't had it.
It's interesting. Yeah. You give me a ton of information, almost too much information. It's being able to digest the information. But take, for instance, I have a gene that tells me I don't metabolize caffeine too well. Or I'm a slow metabolizer of that. So if I drink like coffee in the afternoon past 3 o'clock, my deep sleep just suffers terribly.
Wow, yeah, it kicks in later.
I don't do well with alcohol, especially at night. And there's a couple of DNA snips or genes that tell me that. Otherwise, I have another ApoE gene that tells me I'm like 30 times the risk of developing Alzheimer's. So that's like scary stuff, right? Like that's a fear of mine. But you can test that. And I think that's where you're leading with this.
Yeah.
So you can test that, and really, if you start to jump on those things now, so what are the things that can help me prevent Alzheimer's? It's sleep. It's delta wave sleep to detoxifying the brain. It's washing your inflammation. So if I jump on those now at age 42, that really will decrease my chances of getting Alzheimer's. So you can test your DNA, and there's also things that you can do like certain supplements and seeing somebody like you that can really decrease that sympathetic outflow to really improve the epigenetics. Epigenetics are changes that you can make throughout the day that turn on or off these different transcriptions of the genes.
I'll tell you something interesting. Just it's a little bit of a side tangent, but we can come back to the DNA in a second. But when you talk about the importance of sleep in our world, looking at the brain and the health of the brain, the cerebral spinal fluid, that's kind of like your shock absorber, transfer of metabolites inside of the brain. One of the cool studies that was done a while back, and I think it might have been with mice as well, and it's a TED Talk that you can look up on cerebral spinal fluid, is that when we sleep, our brain literally will shrink because it's not as active.
I remember you talking about this.
Yeah,
this is interesting. Yeah.
And so as the brain shrinks, there's more room for the cerebral spinal fluid to literally go into the cracks and crevices and like wash away all those metabolites that have built up throughout the day. And when you look at things like Alzheimer's and MS and Parkinson's, maybe not Parkinson's as much, but definitely MS with scarring, definitely Alzheimer's with these like plaques and buildups in the brain that are made up of these metabolites. The question is, how come those metabolites weren't either broken down and removed or even literally washed away? You know what I mean? And that's one of the reasons that they theorize why sleep is so important, is to allow that to happen. And then in our work, because we deal with the alignment of the upper neck, there's literally studies that show that you can pressurize that drain pipe, for lack of a better term, which can impact. There's studies out there that'll show like the pulsing of the fluid, which is really pretty cool stuff.
Yeah, I didn't even think about that too. How
Yeah.
you can change the dynamics of that's fascinating.
You can look it up. There's a guy, one of my mentors named Scott Rosa. He's pioneered a lot of this work. He's an upper cervical chiropractor, but he's just fortuitous enough that his practice is right near Phonar. And Phonar is a company that manufactured the first ever clinical MRI. And now what they're doing is upright MRI. And then they have these really high-end, high-resolution coils where you can actually watch and see the pulse rate and the pulsing of cerebral spinal fluid. There's like a special MRI filter. So then they do that before and after treatment. And you can see a change.
Love it.
You know, it's really,
Love it.
it's pretty cool. And that goes into the concussion world because one of the theories is when these football players or wrestlers or hockey players have a concussion, if there's literally like a corking effect where the brain transitions into the spinal cord, that can create that back pressure.
Sure.
And then over time, maybe that's why people have this CTE, chronic traumatic encephalopathy, is that if the CSF isn't pulsing over decades the way that it should, that could be why we're developing some of these inflammatory problems of the brain. So it's kind of, it's kind of pretty neat stuff.
That's fascinating.
Yeah. Okay, so I want to make sure we're going to be rounding it up here in a minute. Doc's got some patients coming up, but I want to make sure that there was nothing that we didn't leave anything unturned. We hit, I think, some really important things though when it comes to injury recovery and regenerative medicine and some of the solutions for some more holistic approaches. And you even were kind of concluding in a way that is natural, I think, to even Dr. Scott is an osteopath by training, right?
Yes.
And osteopathic medicine and chiropractic medicine were always kind of that natural sort of way. And, you know, instead of bumping the symptoms with, I always compare it to like the amusement park where you're hitting the gophers, you know what I mean?
Say it a lot.
So it's like, you know,
Say it a lot.
treating the headaches or treating this or treating that.
Yeah.
Versus like, how do we fundamentally just help the body operate better? You know what I mean? So we did cover a few different bases, but was there anything we didn't cover that you guys wanted to discuss or just make people aware of? That I mean, we covered a lot of good ground, and they do hormone replacement therapy. I saw that you do some of the laser work, and I don't know if you still do Beamer, but like there's all kind of different ancillary therapies and things just to try and again help the body perform better. But was there anything?
That's really no. I think that's you alluded to the DNA. I think that will be the future of medicine. That and where mitochondria comes into play. But
And you guys do that testing, or you order it and kind of help to manage or kind of read that? Very cool.
Yeah.
That's awesome. That's awesome. Well, I could go on because that's just what I do, but I be responsible. We hit our half-hour mark. I really appreciate you guys for tuning in and hanging out with us. If you have any questions at all, please do not hesitate to contact Regeneration Pittsburgh here in Wexford. Comment, send them a message if you have any questions. And any last words from you guys before we shut her down?
Thank you so much for
Absolutely.
this opportunity to chat with you. I know we could chat for hours
That's right.
together, but we appreciate it.
It's my pleasure.
Thanks, Ethan.
Doc. All right. We'll see you guys. We'll see you next time.